GMA Health Alert, new data out on the GLP-1 weight loss medication Wegovy. Researchers finding that it may be more effective at preventing heart disease for people living with obesity. Medical correspondent Dr. Darien Sutton is here with more. So Dr. Sutton, these are some really dramatic findings, so help us break this down for us.
They really are, but just for context, this is data by press release. So although these results are preliminary for Novo Nordisk, the creator of Wegovy, they are important, however, even for those who might have a history of cardiovascular disease. It's suggesting that Wegovy, which has the active ingredient semaglutide or semaglutide, is doing a better job at protecting the heart than tirzepatide, which is the active ingredient in Zepbound. Some more specific details. In the study, they followed adults who were either overweight or obese with a history of cardiovascular disease, and they found that those who used Wegovy had a 57% reduction in the risk of outcomes such as heart attacks, strokes, and cardiovascular disease compared to those who used tirzepatide. But a closer inspection into this data, they followed for less than a year. So what that tells us is that at best, this is an early signal that not all weight loss medications carry the same cardiovascular benefit.
What did you call this, data by press release?
Data by press release. Very important to understand that context.
No, and I think it's important because, I mean, just as a quick aside, all of these companies are attached to publicly traded companies. Their stock goes up and down when they put research like this out. It's also kind of its own form of advertising because people then go to their doctor and say, wait a minute, I saw these results. Right. Should I be taking that medication? How do you have the conversation with your doctor and not be sort of taken away with the advertising?
You're absolutely right. There are real life decisions being made from this information, and that's why it's so important to contextualize it and that we have these discussions. When you're making the decision, the questions you have to ask yourself is what conditions do you have that might put you at risk? What risks are you most concerned about? And then what can you comfortably and consistently maintain? Now, in terms of the cardiovascular benefits, semaglutide, again, the active ingredient in Ozempic and Wegovy, has the most research behind it in reducing the risk of cardiovascular events. But important reminder, weight loss, regardless of the intervention, brings health benefits, reducing your blood pressure, reducing strain on your heart. So again, back to the basics, whatever you can comfortably and consistently and safely maintain.
So say someone's going to start this, one of these, what are realistic expectations for them?
I'm so happy that you asked that as well, because often when we see these used, especially on large platforms, you have to realize that they are meant to be used in conjunction with nutrition, with movement, with sleep, and close monitoring by a physician. So you will see very different outcomes. On average, we can expect 15 to 20% of weight loss when you're using either of these medications. Now, looking at the data and the head-to-head comparisons, they show that tirzepatide, the active ingredient in Zepbound, tends to be associated with marginally more weight loss. But at the end of the day, it is most important to understand that it really is whatever you can consistently maintain, and of course, what is accessible and affordable to you.
Thank you so much. Really helpful.